Hey guys, I wanted to spend a little bit of time clarifying some of the confusion that surrounds whether or not dental offices and the staff and employees at a dental office need to wear masks. I spent some time kind of diving into the rather immense data on the CDC website, um, and I found something that might be very misleading. I think it's why we're seeing several dental office colleagues and friends and peers that are kind of confused on what this is. So if you click on, let me actually go back and just, I want to walk everybody through how I got to the information I got to. So I typed in Google CDC transmission map, COVID-19 by county. So if you click on here, this is a place that the general public will go to see, are the communities classified as low, medium, or high. That's called the community level. So they have something called county check, something like this here. If you want to know what York County is, essentially how many people as a percentage of the population are sick with COVID, this gets classified as low. Let's look at a few other counties here. Androscoggin, low. Cumberland, low. So for all intents and purposes, the actual number of people that are sick with COVID is rather low. This is where it gets confusing. This particular metric, the county check, is for the general public. It's not for healthcare facilities. So if you scroll up a little bit, again, I'm still on that first page that I clicked on, for healthcare facilities. So if you click on this hyperlink here, it's going to bring you over here. You're going to get something like this. So this was the update that came out back in September. It wasn't very well publicized, but I think there was a general rumbling within the profession that, oh, we don't need to wear masks anymore, which is partially true, but not entirely true. So if you kind of scroll down, I would encourage everybody to read all of this. I'm only hitting the high points relevant to the conversation of, in Maine, do we need to wear masks? So when COVID community transmission levels are high, source control is recommended for everyone in a healthcare setting. So if you kind of read that quickly and you go back here, well, the county says low, but that's the confusing part. Community transmission and community level are two different metrics, okay? Community transmission is the term that's used for healthcare settings when guiding healthcare facilities and how they should make decisions based upon the risk levels of transmitting or acquiring COVID with their peers and their patients. So again, community transmission and community levels are two different things. So if we click on community transmission, we get this one here. All right, so this is actually the same page. I'm sorry. No, you click that link and it brings you here. All right. Defining community transmission. Community transmission is the metric currently recommended to guide selected practices in healthcare settings. Again, to differentiate it from the public, to allow for earlier intervention before there is a strain on the healthcare system and to better protect individuals seeking care in these settings. Again, community transmission is different. So how do we know what the risk profile is and the staging is for community transmission? Well, you click on this hyperlink here, and this is what comes up. Well, this is very different. If we go back to community levels, we're low. But if we look at community transmission, you can see there is no low in anywhere in New England. You know, over here in Michigan, there's a few counties that are low. Again, it's classified as a transmission rate. So essentially, it's a different classification to say, look, healthcare facilities should have different standards because of the potential high risk for sick patients to be involved and the kinds of things we do in healthcare facilities. They did a very poor job of articulating the difference between the two, which is why I think there's a lot of confusion. But how do we make a decision whether or not we are required in dental office facilities to wear a mask? Well, essentially, if you're in the red, you have to wear a mask. This changes every day, so it's up to the practice to keep up to date on these changing metrics. But we see here, this is kind of from that same website, just farther down. So this highlighted here: when COVID community transmission levels are not high, healthcare facilities can choose not to require universal source control. But what that means is masks being part of it. So if you scroll down even further, I'll come back to that. There's quite a bit of explanation on what that actually means. In a nutshell, if you're in the red on community transmission, masks are required according to the CDC in healthcare facilities. So hopefully that clarifies the difference between community levels and community transmission. But if you scroll down further on that page, I think there was an interesting point here. So they actually have dental facilities as its own category. It's really up to us to make sure we contact the state dental boards and the state and local health departments. As far as I know, up to this point, both the state dental board and the state of Maine CDC basically cede their decision making to the CDC's recommendations. I have sent an email to both of these departments to try to get a better sense of what that is. If I get any information that's different than what my assumption is, which is they're going to follow the guidelines that I just went over, I will let everybody know. But in a nutshell, there's a lot of information here, okay? And I would hate for any one of us to kind of fall short in how we're taking care of our patients and then end up getting in trouble with the legislative oversight that may or may not consider us in violation of what the standards are. So, in a nutshell, again, come to this page here. I would bookmark it and check regularly to make sure that your county is not in the high section. Substantial seems like a new term. I didn't see that several months ago, but here it is. So hopefully this helps. If you guys have any questions, shoot me an email, toothdoc17@gmail.com. All right, take care.